everyone. We're joined again today with Dr. Tatiana Haverluk, founder of Hello Sono, to discuss a POCUS case entitled Urinary Retention, How POCUS Helped a Patient Skip the ER. So, Dr. Haverluk, it's good to see you again.
Good to be here, Randy.
So, tell us about this case.
Yeah, it's very simple and quite common. We had an older gentleman coming in with some urinary symptoms, some hesitancy, and pressure in the lower kind of abdominal area, pelvis. And basically, the physician wasn't sure whether those were more symptoms consistent with a UTI or whether there was a clinically significant urinary retention happened that requires obviously two different managements. And they ended up doing a point of care ultrasound of the bladder and actually the kidneys as well to see if there's any retention present. And they found that there was. They had the patient urinate first as much as they could, and then they got the post-void residual on the ultrasound, and it was 513, I believe, mLs. So there's way above normal, and the patient ended up getting a urinary catheter, which is really the treatment for urinary retention, and it prevents, downstream effects. So I guess upstream effects of
Yeah.
causing kidney damage, et cetera.
Okay. So how does POCUS help differentiate between the urinary tension and other cause of urinary symptoms?
Well, it's more if there is a significant post-void residual in the bladder, so the volume, then
Right.
you know that there's urinary retention. So the cutoff number is anywhere between 100 and 150 in older patients. The absolute normal, especially for younger patients, would be 50 mLs. So if you're having more than 50 mLs inside the bladder, that means you're not fully voiding. So 500 mLs is a big number, and
Oh,
that does
yeah.
require, drainage.
So, what does that look like on the actual POCUS itself when you're doing that scan? What sort of you're looking for?
You will see a big black blob,
Okay.
because ultrasound, when it hits a fluid pocket, fluid basically looks black or anechoic on ultrasound. The ultrasound beam gets fully transmitted through fluid. So you will see a fluid-filled structure, and you've got to look at it in two different planes, in transverse and sagittal plane on ultrasound. And you can do some measurements there too. You can scan through the whole structure. You can even visualize the prostate if you were looking for that. And then you can look for clots, for example, or any even wall thickening consistent with a UTI, say. And then the most important and key question here, the focused question of POCUS, is there urinary retention? So you do measurements. You do two measurements in a transverse view and one more measurement in the sagittal view. You multiply those together and then also by a correction coefficient, and you get your post-void residual approximation. And some of the devices will do it for you,
Okay.
including a lot of handheld AI-powered devices now. They will do kind of like a very quick bladder volume. You don't even need to put the calipers on the bladder.
Oh, wow, that's great. So talk about the AI assisted bladder volume tools. What does that sort of look like if and
And it's,
yeah,
I mean, it's very simple. You basically you fan through the whole bladder or scan through the whole bladder, and it will pick kind of like the largest, area to measure, and then you do it in the sagittal plane, or sometimes you don't even need to get at the sagittal plane, and it will give you still an approximation. So super quick. There's actually research on this. It takes less than 15 seconds to use, POCUS to get a bladder volume, which a lot of places, especially urgent cares, they might have kind of bladder scanners
yeah,
that are not a full ultrasound device. But I think the benefit of ultrasound is that you can look at a prostate more easily. You can identify a bladder mass or a bladder clot incidentally. You're not necessarily looking for it,
right.
but you can find something incidental. And we've had a lot of cases like that, actually, that incidentally you find something. And then plus, you can also image the kidneys to make sure there's no hydronephrosis in the kidneys. Because if someone has had a urinary retention for some time, say they've been retaining for 2 days, they might have caused upstream effects that are affecting their kidneys, and seeing that hydronephrosis in ultrasound would heighten kind of the acuity of the patient.
I got you. So, and it's sort of, I know we always talk about the billing and coding part of these types of things. If you were to scan for other things that you see as you're in there, are those all billable?
Well, there's a CPT code just for the bladder kind
Yeah.
of scan, and then there's a CPT code for kidneys. So typically, I would do renal and bladder in this case. Depending what you're suspecting, in an older patient, you might want to look for AAA. If an aortic aneurysm is really large, it might be compressing the bladder or the ureter or causing some other, you know, strange obstruction symptoms that you can piece together with ultrasound. But, I think with ultrasound, because it is a point of care ultrasound, it is focused, we do want to ask really key questions and also remember the limitations that we are not doing a comprehensive scan. Like I can say like, hey, I'm going to look for AAA, I'm going to look at the prostate and the bladder volume and look for hydronephrosis, but I might still miss a mass outside of the bladder that's compressing a ureter or something like that. There are other things we can miss.
Focus the POCUS.
Focus the POCUS, yeah.
Well, this was excellent, interesting case, and skipping the ER, that's always a good thing. So thank you again today for another interesting case. We look forward to the next one.
Awesome. Thank you. Me too.
Please support our mission to improve quality of patient care through education. Join us, follow us, and share this content with family and friends.